So with this in mind, I say I'm delighted that as well as hearing from the universities, we're now in a position that we can actually hear from students and supervisors who've been currently working through the postgraduate certificate starting back in last September. So with that, we're going to hear from Javi and Debbie in a minute. But firstly, can I come to Trish, who can outline her experiences working on the Newcastle course? Trish, over to you.
Thank you, John. Hello, everybody. So my name is Trish Turo, and I'm a research nurse at Pilgrim Hospital in Boston, Lincolnshire. And I started on the PG Cert in September last year. So looking forward to the end of it. As a research nurse, I work as a clinical research coordinator. So I do this every day. Next slide, please. Which means I meet my supervisor more than a lot of people because I work with her on a daily basis. So we talk about my studying, and we've managed to marry my job role and my research activities to the studies. So I wouldn't be able to actually put a time to it because it's sort of an everyday thing. So minimum once a month, and this can be face-to-face in the office or virtually if I'm working at home or on study leave like today. In terms of expectations of a learner, on the next slide, please. How much time is involved is SBA handbook guide. I think at the beginning, John mentioned the 60 credits equals 600 hours. And this requires a lot of self-discipline, motivation, engagement, and participation. So what I did was sort of like cut it down a bit and drill it down to about 2 hours a week on a module. And that has sort of worked for me in terms of self-directed studies. Then I have made sure that I've engaged with the online discussions so that I'm learning from my peers and my colleagues. So even though it's 100% online and I haven't attended physically any sessions, that online and virtual presence has been very significant and instrumental to my learning because I have engaged and I've participated, and that is the best way to get the learning out of this, the best out of the course. Thank you. I will hand over to Javi and Deborah to take over.
Hello, thank you for inviting us to speak as a supervisor and mentor team. I'd like to introduce myself. I'm Debbie Dellafera. I'm one of the senior research nurses at the Clinical Research Network Wessex, and I'm also a principal investigator on some studies and co-investigator mainly on neurodegenerative studies, Parkinson's and stroke.
And I am one of the students in the course through Exeter University, and Debbie is my supervisor. So we're going to answer very similar questions to the ones that Trish answered from our perspective. So I think the first question is about how often we meet. We're lucky to that Debbie is my line manager, so we are meeting quite often. But I will say, for the purposes of the course and of the practice experience, possibly about once a month is what I think we're aiming to do, because it really allows us to make sure that I am in track and we're reaching all the objectives that we've put. And these meetings, the initial one, I think it took about an hour. An hour, but just to say that prior to this, Javi has like an agenda all lined up, and we've got aims and outcomes and all that sort of thing already pre-prepped, so that we're well on track for these meetings. So they're pre-planned meetings that go in the diary, and we always keep them as a priority because it is a priority in this course, delivering this course, and we'll go through SIPs and experiences accordingly through that. And then I'll listen to what Javi's got to say, he'll explain, and we'll go through them, we'll discuss. And then I write up an evaluation. It takes probably about 20 to 30 minutes per SIP with any recommendations or
any future learning outcomes, and then sign them off.
So I think we've had these meetings both face-to-face and virtually, and both have worked well. But as Debbie has highlighted, I think from the study, from the student perspective, it's really important to be proactive, to make sure that you prepare ahead of these meetings, to make sure that you have some aims and you come with some additional opportunities for your learning. So I think in terms of your role as a supervisor, Debbie, how much time do you think you're involved and is required from you?
Well, I think it's integral from the very beginning of when the student gets accepted, so that you make sure that you're part of that process, part of that course. I mean, it almost feels really that you're doing the course with the student. You know, it's quite exciting that you get involved at an early stage, that you read your handbook, that you meet up as soon as the student gets on the course, you discuss what they want to do, what their preferences are, what they want to get out of it, and how you can start to influence and input into that. So along their journey of delivery of the course, I think it's really important. I give probably an hour per session we give, don't we? Like I said,
it can reach up to an hour. It depends on how many experiences you're going to discuss through. And I think the other question that we were interested in answering is, who else can be involved in the supervision of a learner to support you as a supervisor?
Yeah, well, luckily, I think we're very fortunate that obviously I work for CRN Wessex, and so therefore it's a good hub to work within. So there's an awful lot of good contact with people. For example, we've got study support on the doorstep. We've got finance advice. We've got comms teams, internal, external. We've got the facility of Southampton on the doorstep, so we can tap in and use the clinical research facilities where they do phase 1 trials. We've got lots of opportunities for taking on and leading things for students, so that Javi's involved in the press, which is a high level objective, and he's on the actual committee now. He's got involved in a very big way. We've got research delivery managers in all specialties within public health, secondary care, social care, patient public engagement, and social support. And we look very much at the underserved communities. We've got an RDN looking at that. So there's an awful lot on tap that we can use. We also are a training hub here, so Javi facilitates anyway on the next steps.
And PI,
And
yeah.
principal
I think
investigator.
I think the key message there for potential supervisors and students is get in contact with your local CRN, because it really increases the opportunities. And we've been able to identify a lot of experiences that will broaden my experience as a research nurse and put me in a better place to potentially be a PI and further studies through linking with different support and different members from our local CRN. I think in terms of how much time is required, is involved for me as a student, I say it is difficult because it has some peaks. Obviously, you've got assignments that you need to put in, but I'll say very similar to trees, you need to try and hit at least a few hours a week to make sure that you're on track. As I said earlier, it's really important to be proactive and to, take an approach of taking the course as an opportunity to really develop you as a professional. So the Exeter course is really focused on reflection, and I think it has been really interesting to reflect on different experiences to be able to draw on some learning from that. I think that's most of the questions we wanted to discuss. So thank you very much.
And then from a supervisor, just to say point of view, I think it's really important that you give the time, but you make the time. So as a line manager, I have sort of issues of conflict maybe, but I'll give Javi that time to make sure that, that he can do the work, he can do the sits, he can actually go off and join the groups, have invitations to those groups. But honestly, don't be put off anybody that wants to be a supervisor, because I've got 2 students and it's fine, it's very manageable. And it's really enjoyable, and it's great to see them go off and explore different opportunities and broaden their experience in different areas, which they might not have had taken the time out of work to do otherwise, and that can give back to the organisations. So I think it's great. It's a really good course.